Hey, this is Dr. Robert Mickley. I'd just like to discuss a straightforward sinus lift case, the Crestal lift. A couple of things to look out for as you're planning these cases, and the way I like to design guides, utilizing either the Blue Sky Bio fully guided sinus lift kit, or even just the fully guided surgery kit, and I'll discuss how that works. So, first thing I like to do when I look at a case is we're going to look at our missing space here, tooth number 14. And the first thing I'm going to look at is to check the adjacent teeth. Nothing will kill a sinus lift faster than some infected roots next to your implant site. So we look at the number 13 site next to it, previous root canal, apex looks nice and clean, we're great. But different story here for the number 15. 15 has got two things going on. One, it's got apical lesions. And we can see it right over here. But more than that, this apical lesion, which is not uncommon in the posterior, is draining into the sinus. And you see all this fluid underneath here is a likely pus draining from that tooth. That is obviously got to be cleared up before the sinus lift is completed. The way we'll do that is either extract the tooth first and wait, or what I'll sometimes do is put the patient on antibiotics for a week in advance, let that infection calm down, and then take out the tooth and do the graft at the same time. And that's a judgment call based on what I see, and I tell the patient if I see a lot of pus when that tooth comes out, we're going to abort the implant that day and come back and fight another day, another week or so. But if it's a clean socket, the antibiotics is doing its job, and we'll continue them on antibiotics for another week afterwards, then we'll leave them as is. But again, safer way to do it is do it in two procedures, but it can be done in one if it's managed well with antibiotics. But then we get into the nitty-gritty of the actual planning. So we look at the site. This is a previously grafted socket. You see that we still have some bone particles. It's not a complete heal, but when I see density like this, it's good enough to stabilize my implant. I'm going to talk about a couple different implant selections to see how to best manage softer bone. But then we take a look at just the measurement. How much room do I have in my crest to my sinus? So we'll go to our measurement tool. We'll go from our sinus, and we'll just kind of line this up as to where the implant would be going. So we'll end up about here. And we'll say my crest is somewhere around here. I have some graft material here. This graft material maybe not to be so solid, but I'll guess my graft is going to go till about here. So there it looks like 9 millimeters, but it sometimes gets tricky because based on the angulation of where your implant's going to be going. So rather than just using the measurement tool, let's actually put an implant into place. So we're going to go to our Blue Sky Bio implants. We can talk about the Max implant. You can see the thread design of the Max implant is a standard implant with moderate aggressive threads, but I like to use when it's really soft bone, especially the Blue Sky Bio Forte implant, which is essentially a Max implant connection. It's a conical hex on the inside, compatible with Noble Active. They're all on the narrow platform stage. So no matter what size implant you're using, from a 3.5 all the way to a 7, it has the same narrow platform just to make ease of prosthetics. And let's go over to, let's see, a 4.3 body. And the way that these Forte implants will work is all the bodies are a 4.3 on the inside. What changes as you move up from a 4.3 to a 5 is not the body type, but the threads themselves. You can go from a 5 to a 6, and again, 4.3 body, now 6 threads, all the way up to a 7. And you've just got some really aggressive threads here to cut deeply into soft bone. And it worked extraordinarily well. I'll usually hover between the 5s and the 6s. I'll leave my 7s for a rescue in case I go with a 5 and I'm really not getting enough torque. I'll then move up to a 7 and bite on that bone much harder. But if I go to a 7 early and something's not working out, I don't have anything to rescue me after that. So let's say for a case like this, let's go to a 5, and let's say go to a 5 by 10. So just in terms of sinuses in general, if I'm going to be using an aggressive thread, I want to make sure that I'm lifting far enough so those threads will never get in touch with the Schneiderian membrane, but only get in touch with the bone itself. So let's go ahead and put this implant into place, and we'll start measuring. So as I see here, my bone is really just about here. We're going to want to angle that implant. It's going to be about here. So really the shallowest point I would say my bone is only really to about 7.6 on the distal, and then gets up probably to about a 9 on the mesial. So we're going to have really just a very mild sinus bump, which if you're getting new into sinus grafting, it's really a great way to approach it. Take a case where you would otherwise be able to place an implant and shorten it and just do a sinus bump at the same time. And you see here, let's look at the diameter of our bone. We've got plenty of diameter of bone here. So I can easily swap this out for, let's say, even a 6x8. Plenty of space, and now I'm just shy of the sinus. So that's also another way to go in a case like this. So again, what I suggest to people, if you're going to be practicing sinus lifts, trying to get better at them, choose cases that you have a rescue implant that you can place a shorter and still get it to work, but the sinus graft will be that much better. And especially when the bone is this soft, to get onto cortical bone, to grab onto that during implant placement will only increase your primary stability. But let's, again, continue to plan our case. So one of the really nice upgrades with Blue Sky Bio recently has been the automatic segmentation of the maxilla and the teeth. The way you do that is you'll access the Model Master, you go to segmentation, and all you do is simply by the click of a button, we're only do the maxilla here, so just for time's sake, I'll unclick mandible, click Start Automatic Segmentation. And what this will do, as it says, we'll segment out the teeth from the jaw, and we'll segment the maxilla itself. And you're going to see how different that looks and how much easier treatment planning becomes. And now we simply check the outline of what has been segmented out, and we hit Create Surface. Excellent. So now I'll turn off the CT surface. And now all I have is my segmented part. Now what I'll do is I'll click on maxilla, and I will turn down the transparency. So what I find is this really allows me to see exactly where my sinus is, where my adjacent teeth are, and really just allows me to dial in treatment planning that much more accurately. I didn't appreciate quite how valuable it is until segmenting became automatic and became free. That really opened things up, and kudos to Blue Sky Bio for allowing that. So I'm going to change my angulation here. Now that I see where my teeth will be sitting, I like my distance from this tooth. And again, this molar is going, so I'm not looking to center it to close the contacts here. This tooth is going to go, so we will put the implant in the ideal position. What then I'll do as well is I will take my intraoral scan, and I'll drag and drop it. Hit OK for maxilla. And the alignment AI works incredibly well. Good, we'll double check the alignment by clicking on teeth. And what we're looking for is a airtight seal that's outlined around the teeth. You see, it's a nice tight seal around the teeth. Fantastic. We are good to go. All right. So now we know our teeth are aligned properly. Here, see our roots. We see our tooth setup. Now let's talk about how we design a guide for the sinus graft. So let's say that I like where my implant's going to sit. Now let's say again, we talked about doing a lift versus non-lifting, and we actually changed the implant here to allow it to be a non-lift. If I'm going to right click this implant, and let's say I'm going to change it back to a 10. To go back into advanced or normal, right click, replace. Let's do a 10 here. And again, now we're just doing a small bump into the sinus. So when I'll design my guides, I will, rather than designing it and allowing it to go into the sinus, that means the 10mm drill will actually hit into the sinus. The 1mm drills on the guided sinus lift kit allow you to go 1 millimeter at a time. But if you want to do this as a guided surgery kit alone, what I'll do is I'll switch it to a position which is just underneath the sinus and allow the regular drill to work me just under the sinus. Then I'll switch over to the fully guided sinus lift kit, or if I don't have that, I have the option at that point of using an osteotome. Because we're so close to the sinus, it's going to be an eggshell just to push through. It's a very simple tap. So with a guide, with one drill, I can get myself just shy of the sinus and either osteotome or use a fully guided kit and push through into the sinus that way. So let's take a look at how that would look like. Good, I can look at it from all angles. Let's see from the inside of the sinus, from outside the sinus. And actually the angulation here changes things, that brings it at the angles almost not engaging the sinus. Let's bring that drop more buckle. Try to straighten ourselves up a little bit here. And good, we see we're just bouncing into the sinus. So I don't want to be that high. So rather than doing that, I'm going to just bring my implant down. Just shy of where the sinus is. So if we see here, now I'm coming just shy of the sinus at the lowest point, that tip, and it's got a cutting edge, we'll go another about 1/2 millimeter. So maybe we bring that down just a hair more. Good. Now I know my first drill will get me just short of the sinus, but not all the way there with a 10 millimeter drill. My implant itself is sticking out of the crest now, but again, I'm not using that because I'm going to place it deeper into the sinus once I get a lift. And drop a comment if that doesn't make sense. I'll clarify that again, but most people get that in the first try. That's where our guide tube will set up. And again, I'll be extracting this tooth prior to placing the implant, so we're not going to put our guide onto that tooth intentionally. It may bleed over to it, but I'm not going to use that for support. So let's go about 3 teeth forward. To grab our support, we go into the guide panel. We hit draw curve. Make sure we're in the maxillary model here. And now I'm going to hit shift and just start drawing an outline. And those nodes will appear. We'll continue our line across here. And now we'll close it up. If we see I overshot this corner, all I do is hit the button here again, draw a new line, and that will recorrect any lines here. Everything's looking good. Let's make a little bit of a sharper line here. Beautiful. All right, that is my guide design. All I hit is create a surgical guide. And there we've got our guide. It's going to just make room to accommodate for that tooth, but again, that tooth will be gone by the time I'm using this guide. How do I check that it's seated properly? It builds in a window here. I can also check the fit of the tooth on the mesial. If you'd like, you can add another window in the middle and just add window, and that'll cut a space out. For a 3-tooth guide, if I can see 2 out of 3 teeth, I don't need a window. So I'm just going to remove that. What I do is I'll put some notes to myself, and I'll say plan is let's say we had a 6 in there, but let's say we're going to plan for a 5 by 10. And again, we move that implant down, so the 10 millimeter drill will get us to where we need to go. So let's say 5 by 10, apply text. And there you go. Give myself a pep talk. Prior to my implant. And there it is. I'll simply export this by Save Surgical Guide, drop it on my printer, and I'll have this thing done in about an hour. Okay, hope that helps. Please leave comments in the below, and with any questions, I'll be happy to get back to you. If you'd like to learn more about sinus grafting and all this in great detail with a hands-on course, we'll be running one at the end of June. Today, date of publication is June 6th. We'll be running it that last Sunday in June. It'll be live in Brooklyn, New York, as well as broadcast on Zoom. You're welcome to come in. You're welcome to do it online. Details, again, with the link below. And we'd love to see you all there. Thank you so much, and have a great day.